बिस्मिल्लाहिर्रहमानिर्रहीम बिस्मिल्लाहिर्रहमानिर्रहीम थोरेसिक स्पाइन लेक्चर सीरीज का लेक्चर नंबर 2 जिसमें हम आपसे बायोमैकेनिक्स डिटेल में डिस्कस करेंगे। Structural uniqueness of the thoracic spine. 12 vertebrae from T1 to T12 each articulates with ribs, making this region more stable but less mobile than cervical or lumbar region. Kyphotic curve, natural outward curve helps absorb comprehensive forces. Facet joints oriented in the coronal or frontal plane, which limits flexion extension and allows more rotation compared to the lumbar spine. According to Carl Fettman, during rotation of the head in a weight-dependent position, the entire body tends to rotate in the same direction. This produces a force that threatens to penetrate whatever ground surface supports the body. This is resisted by ground reaction. This vertical thrust through the body is responsible for the motion of the typical scoliotic curve seen in the spine ड्यूरिंग रोटेशन। और ये जो है ये सर्विकल से शुरू होता है, थोरेसिक पे आता है और लंबर पे आता है। और इसका एक कॉन्सेप्ट है जिसको स्पाइनल इंजन भी कह सकते हैं। और स्पाइनल इंजन का एक कॉन्सेप्ट है जिसके थ्रू फिर हम वॉक करते हैं। बजाय तो लग रहा है कि हम अपने लेग्स यानी लिम्स पे वॉक करते हैं, लेकिन उसको पुश देता है ये स्पाइनल इंजन। ये जो स्पाइन क्वाइल अनक्वाइल होता है उससे पुश मिलता है और इससे हमारी मूवमेंट जो है वो वॉकिंग जो है वो प्रोड्यूस होती है। The thoracic vertebrae bear and distribute the compressive force. The compressive load approximately at T1 is 9%, T8 is 33%, and T12 is 47%. तो जो ज्यादा वेट बियरिंग है वो T12 है, वहां पे फ्रैक्चर की पॉसिबिलिटीज हो सकती है as compared to the other. The most important stabilizer in the thoracic functional unit mechanics is the intervertebral disc and rib head joints after flexion, extension, side bending, and axial rotation loading. In case of rib head resection, range of motion increased by 80% under all loading modes. In case of total resection of the posterior ligaments complex, increased range of motion about 40% under all loading modes. The zygapophyseal joints function to restrain the amount of flexion in anterior translation of the vertebral segment and to facilitate rotation. They appear to have little influence on the range of side bending. Flexion of the thoracic spine in weight bearing is initiated by the abdominal muscle and in the spinal erector muscles, eccentrically controlling the descent. Flexion may also occur during bilateral scapular protraction. 4 to 5 degree of flexion at the upper thoracic, 6 to 8 degree in the middle thoracic, 9 to 15 degree in the lower thoracics, and total range of thoracic spine flexion is from 20 to 45. End range flexion is resisted by the posterior half of annulus and by the infection of the zygapophyseal joint. Extension of the thoracic spine is produced by the lumbar extensors and results in an anterior glide of the superior facet of the zygapophyseal joint. Total जो extension range है thoracic का, that is 15 to 20 degree. Side bending side flexion. Side bending of the thoracic spine is initiated by the ipsilateral abdominals and erector muscles and then continued by gravity. Total जो है उसका range 25 to 45 degree दो टर्मिनोलॉजी यूज होती है जिसमें एक लेट एक्शन एंड दूसरा है रोट एक्शन। तो लेट एक्शन मीन साइड बेंडिंग contralateral rotation with contralateral rotation। जब हम साइड बेंड विद contralateral rotation करते हैं तो उसको हम लेट एक्शन कहते हैं। द टर्म यूज लेट एक्शन। और एप्सिलेटरल साइड बेंडिंग एंड एप्सिलेटरल साइड रोटेशन दैट इज कॉल्ड रोट एक्शन। तो ये दो टर्मिनोलॉजी जो कंबाइंड मूवमेंट के लिए टर्म में यूज होती है, रोट एक्शन एंड लेट एक्शन। रोटेशन and let action mean side bending coupled with contralateral rotation, and rotation side bending coupled with the same side rotation. Axial rotation is produced either by the abdominal muscle and the other trunk rotators or by unilateral elevation of the arm. Pure axial rotation can only occur at 2 points in the spine aid, the thoracolumbar junction and the cervicothoracic junction. The axis of rotation lies within the vertebral body and the mid-thoracic joints, but interior to the vertebral body and the upper and lower joints. Ribs stabilize the thoracic spine, reducing moment and increasing load distribution. Pump handle upper ribs and bucket handle lower ribs movement support breathing and influence spinal motion. The diaphragm descends and pulls the central tendon anteriorly through the fixed 12 ribs and L1 to 3. T1 to 7 glide anteriorly, T8 and 10 glide in anterolateral and inferior direction, T11, T12 remain stationary except for slight caliper motion increasing the lateral dimension. Normal expiration, usually a passive process. The mechanism during expiration, the ribs rotate anteriorly, the tubercles and cast or transverse joint of T1 to 7 glide superiorly, T8 to 10 glides in posterior medial and superior direction, T11 and 12 remain stationary except for slight caliper motion decreasing the lateral dimension. Functional biomechanics. Movements in the thoracic spine are coupled. Lateral flexion occurs with rotation, particularly in the upper thoracic segments. During activities like breathing, reaching, or twisting, thoracic spine movement integrates with shoulder girdle mechanics. तो ये थी thoracic spine की डिटेल बायोमेकेनिक्स। नेक्स्ट में इंशाल्लाह thoracic spine की सीरियस पैथोलॉजीज आपसे डिस्कस करेंगे। थैंक यू।